It's 2 a.m. Diane is lying in the dark, heart pounding, already doing the math on how few hours of sleep she has left. Here's the strange part. She's already on Zoloft. She was told it will fix exactly this. So why does she still feel like this? Does Zoloft really work the way you were told it does? And what's the one misunderstanding that keeps millions of people stuck? In the next few minutes, I'll show you what is really happening inside the brain on this medication, 4 things almost no one tells you, and why how you start it and how you stop it can change everything. I'm Dr. Air, quadruple board certified psychiatrist. I've treated thousands of people struggling with anxiety, and sertraline, the drug you know as Zoloft, is one of the most prescribed medications for anxiety and depression. But if you're on Zoloft and you still feel anxious or numb or stuck, you're not broken. Your nervous system is doing exactly what an overloaded nervous system is built to do. Let's go back to Diane, 52 years old, experiencing constant chest tightness, tension, and excessive worry. Her doctor started her on Zoloft, and like most people, she expected to feel better in a few weeks. Instead, for the first 2 weeks, she felt worse, more jittery, more anxious, worse sleep. She almost quit the medication. And that is exactly where most people do quit. Right before the medication would have started to help. So why does this happen? Here is what your doctor may not have explained to you. Zoloft does not just top up your serotonin like adding oil to an engine. Researchers now believe SSRIs work by slowly rebuilding the connections between your brain cells, something scientists call synaptic density. This takes several weeks. Your brain is quietly remodeling itself, and remodeling is sometimes messy before it is beautiful. Picture a kitchen renovation. Before the new room, there's dust, noise, and everything torn open. That is your first 2 weeks. So if the early days feel rough, that is not the drug failing you. That is the construction phase, which means the early window is the time to stay close to your prescriber, not to disappear. I want to make it clear that I prescribe these medications. They help real people every single week. This is not an anti-Zoloft video, but here is where it gets interesting. Do you remember the blurb? Zoloft was approved by the FDA back in 1991, the second drug of its kind after Prozac. And in 2001, Pfizer ran a now famous commercial, a sad little blob bouncing along under a gray rain cloud. The ad said your sadness and anxiety may be due to a chemical imbalance and that Zoloft works to correct it. It worked. Reports indicate that by 2004, Zoloft was earning over $3 billion a year. That one cartoon taught an entire generation how to understand their own brains. There was just one problem. In 2022, a major review in the journal Molecular Psychiatry pulled together decades of studies and found no consistent evidence that low serotonin causes depression or anxiety in the first place. Let that sink in for a second. The story most of us were sold, that you have a serotonin deficiency the way a person with diabetes lacks insulin, was never actually proven. Now, that study set off a big debate, and this part matters because not everyone agreed. Some scientists pushed back. They said serotonin probably does still play a role, just not the simple "you're low so top it off" rule we were sold. They believe it works in deeper, more complex ways through tiny switches on your brain cells and the way whole brain circuits talk to each other. Others noted that the exact mechanism by which SSRIs work remains incompletely understood. The truth is, we still do not fully understand exactly how these drugs work, and anxiety is almost certainly not about one single chemical. It likely involves several brain messengers like dopamine, glutamate, and noradrenaline, as well as factors like inflammation and how your emotional brain networks fire. In other words, it is not one broken part. It is a whole system out of balance, which means improvement comes from rebalancing your entire system. So does Zoloft work? For many people, yes, but not in the way many people think about it. It calms the stress system while your brain slowly rewires. And that single distinction changes everything about how you treat the real cause underneath. And that brings me to the part that surprises my patients the most. This one is easy to miss until it happens to you. A few months in, Diane told me the anxiety was finally quieter, but so was everything else. her daughter's wedding, her favorite song on the radio, a sunset she used to stop and stare at. She said she felt fine, but flat, like someone had turned the color down on her whole life. This is called emotional blunting, and it is far more common than people are told. Surveys suggest it affects somewhere between 40 and 60% of people on these medications. And in 2021, researchers affiliated with the University of Cambridge finally showed why. They gave healthy volunteers an SSRI for at least 3 weeks and found that it lowered their sensitivity to rewards. In plain English, the medicine turns down the lows, but it can quietly turn down the highs too. For some people, that trade is worth it. For others, it is a signal that the dose is too high or that medication alone is not the whole answer. So if life feels gray on Zoloft, do not just accept it as is. That feeling is information you need to bring to your doctor. There's one more piece, and it is the one I wish every patient knew on day one. Coming off Zoloft can be harder than getting on it. When people stop too fast, they can get dizziness, brain zaps, that odd electric shock feeling behind the eyes, sudden waves of anxiety, and flu-like aches. For years, this was waved off as nothing or mistaken for the original anxiety roaring back. We know better now. A 2024 review in Lancet Psychiatry found that about 1 in 3 people get withdrawal symptoms when they stop an antidepressant. And research by psychiatrist Mark Horowitz showed that coming off very slowly in a gradual taper dramatically reduces those symptoms. So if you ever decide to come off, never do it suddenly and never do it alone. Slow and supervised by a mental health practitioner is the right way. And this is the reason I built the nervous system reset, because medication can quiet the calm, but it cannot teach an overloaded nervous system how to feel safe again. That part, the root cause, is what we walk through together step by step in the nervous system reset. The link is in the description below. Now, let me be honest with you. For some of you, Zoloft will be essential, maybe even life-saving, and you may need it long-term. That is not failure. Medication is a tool, not a verdict on who you are. And if you've been anxious for years, calming your system down may take longer than you'd like. It's just the reality of treating chronic mental disorders. But when done right, using a root cause approach and factoring in not just traditional psychiatry, but also integrative psychiatry and lifestyle medicine, that makes all the difference. So here's what finally changed for Diane. Once she understood that Zoloft was a band-aid, not fixing a deficiency or the root causes, she stopped waiting for the pill to do all the work. We looked at her sleep, the blood sugar swings that spiked the panic in the afternoon, the chronic stress she had carried for a decade, the hormone shifts of midlife quietly turning up her body's alarm, the chronic inflammation, gut health, mitochondrial dysfunction. Slowly, with proper guidance, the medication became one tool among several rather than the entire plan. Remember that you're not a person with permanently broken brain chemistry. You're someone whose nervous system has been stuck in protection mode for far too long. And a system that learned to stay on alert can be taught to feel safe again. So the real question was never whether Zoloft works. It is whether you have been addressing the root causes and treating your anxiety as a whole body problem. And that is exactly what I unpack in this next video.